when they took him to wash him, that's when the special unit took him, and then that's when they discovered immediately something was wrong, and I could just hear them hitting him, saying, baby, baby, wake up, wake up. Oh, this is gonna be hard. Ooh. And thankfully, one of the nurses was like, let the mom see him, let the mom see him, because she didn't know if I would see him again alive.
Oh my word.
I feel like when you're a first-time mom, you really have no idea what's going on anyways, and then all of a sudden, boom, you get dealt this hand, and you just have to figure that out as well, and it's really scary.
What's odd is that Ryan and I, sisters, both had children born with medical anomalies, two very different things, but we learned a lot throughout that process, so we kind of want to share with you guys what we went through and maybe some tips on how you can deal with each situation. All right, well, since you had your son first, and you're the oldest, why don't you go first?
What I didn't know before I had my son was that the #1 birth defect is CHD, which is congenital heart defect or disease. I had 2 ultrasounds and both of them came out well. She saw all the chambers of the heart and everything looked good. Fast forward to I deliver, and immediately things start to go wrong. So I got to hold him for like 2 seconds before they took him away. So they took him away and the room just cleared out, which was so strange because I just had my first child and I was left alone. By the time I got to the NICU where they took him, he had already had a collapsed lung. So his lungs were an issue, as well as his heart. They discovered he has TAPVR with obstruction, which is total anomalous pulmonary venous return.
Mouthful.
Yes, I'm gonna read what it is. But basically, a baby with TAPVR, oxygen-rich blood does not return from the lungs to the left atrium. Instead, oxygen-rich blood returns to the right side of the heart. So it's basically like just doing this, which is super bad. Obviously. They had put him under to fix his lung, and the helicopter was being prepped. So they life flighted him to a local children's hospital that specializes in cardiac. So he flew off. The hospital wouldn't let me go with him because of the policy. I had to be there for at least 9 hours.
Well, also you can barely walk, like I understand.
Yes, they just so I didn't bleed out. So there wasn't any issues. They had to keep me there legally. We still obviously had no clue what was happening. We just knew that our son was having open heart surgery at 5 hours old. And I could tell, like, they were bringing in the chaplain to console me because they did not think he was going to survive. And I remember yelling at her, like, get out of my room. Like, I don't need you here. Like, my son's gonna survive, So I shooed her. I felt really bad.
Don't feel bad. You should feel glad that I wasn't there.
He comes out of surgery. At the time that I get to the hospital, he's out. I remember my husband at the time running up to me just saying, he's so beautiful, he's so beautiful. Because he had already seen him, and I was like, okay, so the place that you go is, instead of the NICU, it's called the CICU. So it's cardiac intensive care unit. And that's an open room where you see all the heart babies, and there is my child laying there with his chest still open. No one could ever prepare you for the first time you're really gonna see your child. You're gonna see his heart. And just surrounded by more machines and equipment than I could have ever known existed. I think one of the hardest things was, one, I'm seeing my child, I'm seeing his chest is cut open. I see his heart, and he's just limp. And he wasn't moving when I first met him. He was just laying there. His little arms were tied down too, so he couldn't move because he had so many needles in him. I walked up to him, and they were like, he hasn't woken up yet. It's okay. He's okay. He's still sleeping, but you know, he hasn't moved. He hasn't done anything at this point. And I remember I just put his hand was like this, and I just put my finger there, and I was just like, buddy, mommy's here. Like, I'm here. And then he closed it, and he squeezed so tight, and like that gave me so much hope. I was just like, he's gonna be okay. Like, he hears me. He survived. Like, he's alive. And I went into this different realm and was just pleading with God to take me instead of him, and he didn't. He just was like,
he's like, I don't want either of you.
He's like, just says rest. I got it. He was intubated for a very long time, so I didn't actually get to hold him until he was 2 weeks old. Through our entire 5 weeks in the hospital, he was basically fighting his lungs as well as his heart. He came home with a PICC line, NG tube, which is a feeding tube, and he came home on about 23 or more medications that we had to administer around the clock. So instead of being woken up every 2 hours by a crying baby, we were waking up to alarms to give our baby medicine. You know, we had to do a lot of the crazy stuff. So like when you put it in and then you have to put a stethoscope in and blow air into it to make sure you didn't put it into his lungs, but you put it into his stomach. Like it was just crazy that I was able to do that. So weird, the things that you're capable of when like you have to. We met so many kind people. One of my biggest takeaways were just the families that I met and that I still continue to talk to this day.
And she named her dog after the surgeon who saved her son.
Yes. Kogan.
Dr. Kogan.
Thank you. He's a happy 6-year-old. He is a runner. He ran his first mile at 23 months. There's no stopping him, and it's insane. Well, that was my crazy story.
You want to hear mine? That was 2012. Mine happened in 2013. Sorry, mom and dad, for the stress. Same thing, everything looked great in utero, didn't seem to be a problem. Should have been a red flag when it took me so long to push him out of my vagina. Turns out he had a head condition called craniosynostosis, which is when the sutures, you know the fontanelle, the soft spot on the baby's head, that's in line with one of the sutures. There are 5 or 6 sutures, I forget now, but they're all supposed to remain open so that when the baby comes through the birth canal, they can close like this so the baby can come out and then the brain can grow and then it solidifies into bone. Well, we found out about 3 weeks after he was born that his center suture, which is the sagittal suture, had already closed. So it was already solid bone. So that's why I was trying to push him out and he wouldn't go. We were given the option, you can either do a full CVR surgery, which is a craniovault reconstruction, or you can do this like endoscopic version, which is far less invasive, but sometimes far less effective. Yeah. So we met with Dr. Mark Krieger and Dr. Mark Urata, and they both work at Children's Hospital of Los Angeles. They're both amazing. And they both said if it was my child, I would do the full CVR surgery. So we were like, okay, let's do it. So at a little over 3 months old, he went into surgery, and what they have to do is they cut his head like this in a zigzag, and then straight up here, and then in a zigzag down to this ear. And basically, not to get gross, but they kind of like peel all the skin back and then cut out the suture that is already solidified, and then leave a little space in between. So the bone does kind of regenerate, but basically they just want it to keep a little bit of space there until they're like 2.5 years old, and then eventually the head solidifies in a normal way. We asked the nurses to make sure as soon as he's out of surgery, we want to be there immediately. Like I want to be able to hold him right after surgery and comfort him so that he knows that I'm there. And they were like, yeah. No, they didn't. So he was wailing like a beast, this horrible sound that I'd never heard before, for at least like 20 minutes. But as soon as he heard my voice, I started singing him his favorite song, which was the ABCs at the time. I was just, I don't know, oh God, it's a lot. Sorry. It was just shocking seeing him laying there screaming like that. And there wasn't much I could do. I did try to feed him myself, and he didn't want to eat. He was like on drugs, so he was like, oh. It was the saddest thing. We were there for 5 days. One funny story from the 5 days we were there. It's just, everything's stressful. He was just throwing up a lot. So in the middle of the night, we're trying to sleep, and suddenly there's this loud alarm by one of the machines behind him. It's like the biggest machine in the room, and it's just code red, and it said the word apnea. And so my husband freaks out, jumps up, runs out of the room, runs up and down the hall screaming, apnea, apnea. Which I could laugh about now. At the time, oh, I'm sure it was terrifying. What are the main tips that you would give anyone going through this?
Main tips would be keep a positive attitude. Like I remember we were so positive with him, and I think that made all of the difference. Cry, be a mess outside of the baby. The hospital will give you a social worker, and they immediately start talking about money. And that's super stressful at a really horrible time. our stay ended up being over $1 million.
And then how much did insurance end up taking care of?
Because he was born and never went home and his first residency was a hospital, they were able to backdate that. My mother, God bless her, did so much work for me because I just couldn't even think at the time. But she was able to get the right person on the phone, and I was able to kind of plead my case as to why it needed to get backdated. And because of that, we didn't have to file for bankruptcy. Except people's generosity. If they want to give you a gift card, if they want to bring you food, say yes. And your world stops. So like I had no idea what was going on outside of that world. And it came out like One Direction was a thing and I was like, boy bands came back? I was in the hospital for a month and boy bands are back. I was so confused.
Sorry, my 2-year-old is waking up, so we have to hurry here. Number 1, when you get this diagnosis, it is going to be okay. Number 2 is really talk to your surgeon and your neurosurgeon and your plastic surgeon if you're also given a pediatric plastic surgeon, and really ask them what they would do if you're given the 2 options between a full CVR and the endoscopic version, and see what they would do, because some doctors are more comfortable doing the endoscopic version, but with that version the kid has to wear a helmet for a year, and that's a struggle in itself. So just kind of weigh the options there, what works for you and your family. Next, I would say while you're in the hospital, make sure you hold your baby as much as you can. It's gonna seem like you're hurting your baby, but that's all your baby wants, is just for you to hold him or her, and their head's gonna feel really strange, so just try not to get freaked out by that. And I actually wrote an article about this for Huffington Post, and I'm gonna attach the link down below in the notes down here. Burp your baby as much as possible. Because your baby's laying down this whole time, he or she can't get the gas out, and then they'll end up just vomiting all over themselves. So pick them up, burp them as much as you can, even if you just lean them forward and do this whole number. And lastly, sleep them on a tilt, because you need all that stuff to drain out. Usually when kids have this surgery, they become so swollen that their eyes swell shut. My son's, like, he did look like a little sumo wrestler, but he could still see. So I think it's terrifying for the kids who suddenly are blind. They can't open their eyes and they can't see anything. That is really a scary situation. We are always available if anybody wants to talk to us. Comment below, or you can find us on social media. Actually, that might be easier. I don't know. Find us on Instagram at Candid as a Mother and send us a direct message. And we are more than happy to email with you, talk with you, give you some support, because going through this alone especially is not easy.
If you want to hear more details of my son's story, it will be linked down below.
All right guys, we'll see you next time. Please subscribe, share this video with anybody who needs it, and we love ya.
Oh my gosh, I almost said that.
Really?
Yeah, we never said that before,
I
but we
know.
love you.
And my second baby had a perfectly round head. Here, I'll show you the back of it.
Oh, what an emotional roller coaster.
I know.